Namaskar, viewers. Uh, Diabetes is the second largest killer disease that we discuss, and percentage-wise, you know it better than me. So, what we hear is there is a branch called endocrinology, which is a study of hormones, and which is a chemical messenger that travels through our cells and carries the message. Also, it is very essential for our everyday survival. And um, one of the hormonal important gland is pancreas, and which has a direct relationship with the disease called diabetes. And we have an expert with us who would give us more wisdom on this topic. So we have Rakesh Kumar Sahay with us, and doctor is a president-elect of South Asia Federation of Endocrine Society, also president-elect of Research Society for Study of Diabetes in India, and he also holds a good number of fellowship awards as well as 180 plus publications in various national and international journals in the specific area. So let me formally welcome Doctor.
Thank you.
Suswagatam, Doctor. Thank you for your time.
Namaskar. Thank you.
Namaskar. Doctor, as I said in my opening remark, uh, hormonal change or hormones for that matter plays a very vital role in our every working. So I would first like you to little bit educate us on this particular branch.
Yeah. So basically, thank you for calling me here for this program today. And as you have rightly mentioned, hormones, as you said, are chemical messengers which are produced from various glands. They are these hormonal glands or glands which produce hormones are mainly the pancreas which produce insulin. There are other hormones like glucagon produced from the pancreas. Then there are other hormones like the thyroid gland which produces thyroxine. Then you have the pituitary gland, which actually regulates all the other
Yes.
hormone secretions in the body. The pituitary is the master endocrine gland, we can say, and that regulates many other glands. Like pituitary controls the thyroid function, then the pituitary controls the adrenal functions. Adrenal glands particularly produce cortisol. Cortisol is like a hormone which is required for any sort of sudden emergency that may arise. That's called as a fight or flight reaction. I mean, which happens, which any sort of emergency like that, the cortisol is required, and that is produced from the adrenal gland. That is under the control of the pituitary. Then we have the gonads or the ovaries and testes, which are also again under the control of the pituitary gland. So like that, you have got different glands which are producing hormones which are controlling many functions, many aspects of the bodily functions. So that's how the hormones work, and the most commonest endocrine disorders that we see is diabetes. Diabetes today, we say that we have got 100 million people or 10 crore people with diabetes in our country. So that is the number of people who are suffering from diabetes, and diabetes is basically a problem where there is less of insulin being produced. Insulin which is produced from the pancreas is less than required, less than what is required is being produced. So therefore, that mismatch between the requirement and the production leads to what is called as diabetes.
Right.
So there are different forms of diabetes. You have the commonest form of diabetes, where there's some mismatch in the insulin produced, and then there are other types of diabetes called type 1 diabetes, where there is absolutely no insulin being produced. So they always require insulin. So like
So
that.
type 1 is,
uh,
doctor, mostly genetic one, right?
Type 1 has some genetic links, but there are other factors. There are environmental factors also which can regulate type 1 diabetes, which can influence the development of type 1 diabetes. But many a time it is genetic factors, but there are other factors also which cause destruction of the beta cells. The cells which produce insulin are destroyed by some reason. For some reason, they get destroyed, and that leads to no insulin at all, and that leads to a situation that we see in type 1 diabetes, very high sugars, and they present with suddenly becoming sick and getting admitted to the hospital. And there they always require insulin for to be given to them from outside. So that is a brief overview about endocrine glands, but then we can go on to
Yes.
discuss each of these separately.
Focus, yeah, each of us. So, What does happen when we say there is a hormonal imbalance?
Yeah, when we say there is a hormonal imbalance, that's what. Whenever the because of different factors, less of hormone is produced or more of a hormone is produced, then we have hormonal disturbances. Like
Okay,
you can
so
have, like in diabetes, as we said, uh, insulin production is little less than required. Then there could be some other conditions are there where the insulin production is inappropriate, and they present with hypoglycemia, they present with low sugars. Such people present with low sugars, and they may not have diabetes at all, they may not be taking insulin, but they have low sugars. Suddenly they have low sugars, and that is again because of a pancreatic problem, where the more of insulin is being produced. So like that, if there could be excess of any hormone or less production of any hormone, that could cause problems to us.
got it. So, doctor, coming to the specific of insulin, that is pancreas glands.
Yeah.
Um, I have very live examples in front of me in and around and also in society, wherein people are suffering royally and they are highly dependent on the external insulin supplement, whether in the form of oral medication or through the injection. Um, Now, what I want to understand is all the remedies that are taught, like so-called some sort of kashaya, some sort of intake, some sort of breathing exercise, any other yoga, everything is a preventive measure, is my understanding. Once somebody is contradicted, they have to depend on the medicines for that matter. Now, metformin is a keyword when it comes to diabetes. There is also a lot of skepticism about it that this tablet creates n number of side effects as well. So, what is that you want to tell people that they have to take, but then what they should do to avoid more damage?
Yeah, so I've understood your question. What we are trying to understand here is that when you're dealing with any sort of problem like diabetes, diabetes is a multifactorial problem. It is not just one factor which causes diabetes. Like diabetes happens in families. So if one family member has it, other has to get it. It's not. It is true that to some extent that yes, it is a familial problem that if your family members have it, if your parents have it, you are likely to develop diabetes.
Yes.
But again, a lot of it depends upon how your lifestyle is. If you are overweight, if say parents have diabetes, not all the children may develop diabetes at the same time. They have four brothers and sisters. They may develop diabetes at different times, depending on their lifestyle, depending on their weight, depending on how they go about with their food habits and all that, and the type of exercise they do. So somebody may develop early because he or she, I mean, even the fourth youngest of them may develop diabetes early because that person is overweight, very little of exercise and all that, and then they develop diabetes early because they have a tendency to develop diabetes. The family history is giving you the risk, but whether you develop diabetes or not depends on the lifestyle.
I
So
see.
that's why it is important that we understand about diabetes and prevent diabetes, because diabetes, although we are saying that diabetes is very common, it is also a preventable problem. It is very much preventable. So if you know that you have a risk, if you know that you are gaining weight, you have family history, you can maintain your lifestyle in such a way that you can prevent the development of diabetes.
Yes.
So that is why
It's
it is important.
reversible also, right, doctor?
Yes, it is very much preventable, and it has been shown in different studies that just the changes in lifestyle are much more beneficial than any other medication in terms of preventing diabetes.
Mm-hmm.
So if you are realizing this and making changes in your lifestyle, leading a healthy lifestyle, you can prevent diabetes. Now, after that, what happens is that when you develop diabetes, that problem is there. It is going to be there. Now, even after people earlier, it was thought that when somebody develops diabetes, it's going to be there always, and it is. I mean, if you start taking medicine, you'll have to always take medicine. This sort of fear people have. But what we have to understand is that recent studies have shown that even people who have just say developed diabetes within 1 or 2 years, if they're able to make a major change in their lifestyle, make a change if they're overweight, if they reduce the weight, they can become normal also, means without medication they can be controlled also.
Mm-hmm.
So the use of medication is not going to cause any harm. Similarly, use of insulin is also not going to cause any harm. So that is something which people have to understand, which I would like to educate people, that they always have a feeling that If I start taking medicines, I have to take medicines always. If
Hmm.
I take insulin,
Hmm.
I have to take always. It's not that insulin is, if you take insulin, you'll have to you require to take
Required.
insulin always. It is just that you have developed the problem and you're taking it. And insulin is helping you. And earlier days, what used to happen was people used to not take insulin for a long time. I mean, delay taking insulin because it
Mhm.
was difficult to take, difficult in many ways. Now the things have become easier.
Much easier, yes.
So if you take insulin, even if you're whenever you're advised, it is not going to cause any harm. It is going to be good for you. It is going to prevent problems related to diabetes, and even those who are taking insulin can become be off insulin if they are changing their lifestyle. If they're able to bring about reduction in their weight, it is going to be very good. So in those people, this is in those people who have got adequate insulin being produced in the body, but the requirement is very high. So if they are changing the requirement, they can be off insulin also. Now, this is different for people who have got total insulin deficiency, as we said, type 1 diabetes. They always will require insulin, whether it is given in the form of injections or we put a pump or whatever we do, we have to give them injection. So such people have to take insulin, and insulin is good for them, required for them, is life saving for them. So that is how you have to
Monitor it.
understand about the medications. And as you said, you were talking about metformin.
Yes,
Yes, metformin is a very good medicine for managing diabetes. It is always many a times in most of our patients, it's the first line therapy. That is, we will start off with metformin.
mm,
Now we have other options also in case somebody has got a heart disease or some other problem. Then we have other medicines which are beneficial from that angle also. So we use them before metformin also. Think of them before metformin also. But invariably, almost everybody requires
yes,
metformin.
is on
So
metformin.
metformin is a good drug.
Hmm.
Metformin works very well, but every drug will have some problems.
Yeah.
We can have some problems. Can have some problems. It can have some side effects in some people.
Hmm.
So, like that, there may be some people who may not tolerate metformin. Just because a few people don't tolerate it doesn't mean that it is not a
Hmm.
medication which should not be used. So, I think that is how I would put it in correct perspective for
Mhm.
people to understand is that many people benefit from the use. Most patients with diabetes require metformin. Almost all of them benefit from from taking metformin. A few of them may have some problems with metformin, so it doesn't mean that it is not good for others. That is
I know
what.
my question was it is essential drug that is understood, but
Yes.
it has some side effects like weakening of immune system or many others. So to avoid that or to prevent that, what other supplements
Yeah.
would you like to suggest?
So, let me just tell you something about metformin, clearly about metformin, that it does not weaken the immune system.
Uh-huh.
It helps, brings down the blood sugar,
Mm.
and it is very good in terms of having many benefits of preventing aging, reducing weight, having a beneficial effect on the lipids and all that. So, in all angles, it is good. The only problems that happen, side effects with metformin, is that some people may find it difficult to tolerate metformin because it causes a little bit of GI disturbance. That is, once they take it, there may be some stomach acidity and some bloating sensation, and sometimes some people may have diarrhea after taking metformin. That is in about a small percentage, about 3 or 4 people out of 100 people who take metformin may develop that. So they cannot tolerate metformin. So they we don't want to give metformin because they are unable to tolerate. We can't do anything about it. Then the other group of patients is some people, because metformin after a period of time can sometimes interfere with the absorption of, because it is working in the stomach to reduce the slow down the absorption of other substances. It
Blood.
can interfere with the absorption of B12, one vitamin called
Mhm.
B12. So some B12 deficiency has been noted with metformin. So what do? We just correct the B12 deficiency. We give B12 in other forms, it will be corrected. So we should know that when we are using metformin for a long time, keep in mind that B12 deficiency may sometimes develop. Take B12 because metformin has been working. It may cause B12 deficiency of 10, 15 years of using
Correct.
that, you find that.
Long
But
consumption of
it has done so much good for you in the 10, 15 years that you take little B12, it will be all right for you. Then the other thing is that apart from that, it does not actually cause any of the other things that people are worried about. It does not cause weakening of the immune system. It does not cause any other problems. All those problems are caused because of diabetes itself.
itself.
So, and only other issue is that metformin cannot be used in some places, like when somebody is developing kidney failure.
Mm.
So there, the metformin cannot be used because once metformin in presence of kidney failure can produce certain lactic acidosis can occur. That is, some amount of lactate will produce, which is Normally, also there may be some lactate produced, but that will be utilized by the body. Here
Okay.
in kidney failure, what happens is that gets accumulated. So in
Okay.
somebody who has got who is sick and in the hospital, there we don't use metformin because it can produce lactic acidosis. So, but for these situations, so we should know where it is not tolerated by some people and where it cannot be used because they have problem, kidney problem and all that. So other than that, metformin is a wonderful drug. We
Liver
should
drug.
say it's a wonder drug. Whatever said and done, when whatever said about that,
Mm.
I would say it's a wonder drug which has worked for many years, and most of our patients are on metformin. And without that, for those few people who cannot tolerate metformin, we have very great difficulty in controlling their diabetes, even with other medication. Metformin, because metformin works along with others also to keep their sugars under control. If
Quickly.
metformin is not available, it is very difficult for us to control the diabetes many times.
What do you advise to already diabetes patients, the oral medication or the insulin?
Yeah, so what works is best for them is required. So what I would say is that, see, most people, once they develop diabetes, that is because the insulin is not enough,
Mm.
and the requirement of insulin is high, that whatever insulin being produced, they are producing insulin, but
Not
that
sufficient.
insulin, that quantity is not sufficient.
Correct.
So if you make adjustments in your lifestyle, that makes a lot of difference. Or if you start taking some medicine which will reduce the insulin requirement, that is make the insulin more efficient, that is metformin does that.
Mm.
So it just taking metformin, whatever insulin is there becomes more efficient. Then there are other medicines which increase the insulin production in the body.
Mm.
So all these medicines can work in some situations. But once the beta cells which produce insulin are not working well, because over a period of time they may, somebody develops diabetes, by that time itself some amount of beta cell function is affected. The beta cells are working, say, about 80% or 40%, 50% of their usual function. So over another 5 6 years or 10 years, they may stop. They may further reduce their working capacity is reduced. So there you cannot make them work more than beyond a particular limit. So that is where insulin is required.
Mm.
So all those who have insufficient insulin being produced in the body, they require insulin to be given.
Yes, it's
Otherwise, if they have enough insulin being produced, then all the other medicines can work.
more.
So that is how it is. So if somebody requires insulin, then yes, he should take insulin. He should not worry about it because insulin is best for him. Second thing is that even those who have enough insulin, who are on controlled with tablets and all that, at some times can require insulin. Like, if there's a young lady of, say, 25 years, 30 years, even younger people are developing diabetes now. They may be on tablets before they conceive. Once they conceive, they should take insulin because insulin is safer during pregnancy. All said and done, although other tablets, metformin is also being used in pregnancy nowadays, but insulin is the best medication. Similarly, if somebody is going for surgery, controlled with say 3 or 4 tablets, we would like to stop the tablets just before surgery or on the day of surgery, and during the recovery period also we would like to be on insulin only. So like that, there are some situations, or somebody has severe infections, has suddenly gets heart attack or something like that, they are in the hospital, then they require insulin during the management of these conditions. So insulin may be required in some situations. Wherever it is required, it should be used. People should not have a fear that because
Hesitation.
they use insulin they will have some problem later on.
Mm.
It is just that at that point of time they require insulin, they should take it. And if their beta cells or their insulin producing cells are working enough, they can be off insulin later on. If they're not working, nobody can help it. Then they have to be on insulin. So
Yes.
that is how it is.
Yes. So, doctor, we are talking about people who are already diabetes. Okay, now.
Yeah,
So now I also see that there are two types of insulins. One is a slow acting, another one is a long acting and a fast acting, whatever you call
yeah.
it. So kindly educate on that as well, because some people get into that situation.
Yeah. So what happens is that when you see insulin, basically what insulin does is that insulin is required for utilizing the glucose. Whatever we eat gets converted to glucose
Yes.
during the digestion process. It's broken down to smaller particles of glucose,
Helps in
and glucose
digestion.
gets absorbed into the blood. And in the blood, from the blood, what happens is the cells take up the glucose and
Right.
utilize it for their work.
But
The glucose is the source of energy, or the fuel or petrol, as we would say, for a vehicle. Like that, glucose is there. Glucose has to be taken up by the cells, and that taking up the glucose from the cells requires insulin. So insulin is required to take up the glucose from the blood into the cell, and there in the cell, the glucose is utilized to provide the energy to the cell. Now, what happens is that so how is this insulin secreted?
Hmm.
Normally, in a normal person, we are speaking about a normal person who does not have diabetes, who is
20%.
perfectly normal. In such a person, what happens is that there is a some amount of insulin produced throughout the day.
Hmm.
So throughout the 24 hours, even when he's sleeping, even when he's just sitting calm without doing anything or without eating anything, there also insulin is being produced. That
Hmm.
insulin actually keeps the metabolism under control,
Correct.
allows glucose to be taken up. At that time, glucose is not taken up from the blood, but glucose is used for to convert the glucose into energy, and
Store
also
the
preventing
energy.
the breakdown of fat and other things it keeps doing. So that way, some amount of insulin is produced throughout the 24 hours. In addition, whenever you eat something, immediately insulin is produced. Immediately, a burst of insulin
Okay.
secretion happens within few minutes, and then increase in insulin takes care of the requirement and helps in glucose to enter into the cells. So that is how insulin production happens in the normal person. So when we're giving insulin to a person, say somebody who has developed type 1 diabetes, no insulin at all in the body, then you have to give insulin in that fashion. That is, you have to provide some insulin to cover the 24 hours and also insulin whenever he eats food.
Acting. Hmm.
Okay, so that is how we have to provide. There may be somebody with type 1, type 2 diabetes, say like a older person, say 40, 50-year-old person. He's been having diabetes for 10 years. But now what we see is that he was on tablets, he's on tablets. And now what we see is that the insulin production is not enough
Hmm.
with age and with all the factors that we've just discussed.
Hmm.
So that person may just have, say, his fasting blood sugar may be very high because that insulin which is produced during the 24 hours is not enough.
Yeah.
So then what we do is we can give just a long acting insulin to suppress that, to keep his fasting blood sugar under
Control.
control
Hmm.
and keep everything normal, while the tablets which he's taking may be enough for the food that he's taking.
Hmm.
So it may work like that.
Hmm.
So there, we may just use one dose of insulin in the night. That is how we do for some people. Others will have more severe deficiency. That is, they don't have enough insulin produced during meal. Also, whatever tablet they are taking is not working enough. So they require complete secretion. Complete replacement of insulin with something which is working for a long period of time, and then the short-acting insulin before a meal. So the best way to give it is a what we call as one injection of long acting insulin, and the short acting insulin which works immediately.
Hmm.
What we do is we give it before every meal, that is before the breakfast, lunch and dinner.
Hmm.
So this is the best way of giving insulin, that we are giving what is replacing exactly as happens in the normal, in a normal person.
Hmm.
So that is called basal bolus therapy, we call it. And that is little cumbersome because you have to take 3 injections with each meal and one injection at night. Although nowadays, the pens and are very fine
Are
needles and
sophisticated.
they
Yes.
don't cause pain. So
Yes.
some people take it because that helps very well, keeps the blood sugars under control. But to make it little more convenient, we have got mixed insulins. Mixed insulin means there's the short acting component also in that and the long acting component also in that. So both are there. So we give that twice a day sometimes. So that makes it better than giving 4 times separately. These two insulins giving 4 injections, we can give it 2 injections, and that may work for many people.
Huh.
It may not work for some people,
Huh.
because they have got very severe deficiency, and
Correct.
if when you're combining two things and giving it, you're compromising on the way in which it will work, way in it has to
Hmm.
in
Hmm.
the exactly the way it has to work. So that compromise may work in some people. 70% of the times it may work.
Hmm.
20-30% of times you may still require to give it separately. Those people have to take it like that. So that is how there's some people who require insulin 4 times in a day. There are some as against that those who are taking only once in a day because they have got enough insulin being produced, and
Produced.
some little deficiencies there, we are covering that deficiency, and those people are also getting tablets because they are not just with one injection
Dependent
or
on
many
insulin
tablets.
use. Huh.
So with the
So,
tablets, one injection is working.
wow.
There are others who can go with two injections also. So we try to make it convenient for them instead of giving the 4 injections like that. So that is how that probably explains why there are different insulins. Different people require different. Why people require some people require 4 insulin, some people require just one insulin,
Yeah.
and how insulin can be given along with tablets. So that is how it can be. Yeah.
Okay. I have a lot of questions, doctor. Sorry.
Yeah.
um, Now you just now mentioned that there is a insulin secretion constantly happening in a healthy person. Now, how do we know how much is my insulin capacity? How much is it differs person to person? One question. Second, um, how what do you advise people to know their any particular test they can do to know so that they can monitor it well?
Yeah. So as I told you that, when you would go to a doctor who's dealing with diabetes, what he does is that even though you're talking to him, you're telling him about about when you have developed diabetes, I would ask you all these questions, whether you have a family history of diabetes, what is the type of work you're doing, what is the type of food that you're taking, all these things to assess how much of insulin secretion is going on, what is happening. So all this we can assess clinically also, but just by looking at you, examining you, and all that, certain things can be understood. Somebody is overweight,
Ah,
and so they have more insulin produced in their body. They have more insulin already present,
I see.
and that insulin is not enough. So we try to see that we use medicines which will make the insulin more effective or reduce the requirement for insulin. We'll suggest you to make changes in your diet and start doing some exercise and all that. Why? Because all that will reduce the requirement for insulin.
Hmm.
So whatever is there is enough. So that is how it is. So there are many ways in which we can understand how much insulin being produced. So similarly, if there is somebody who's very lean and thin, who's lost 10, 15 kgs of weight by the time he develops diabetes, and he is that such a person is coming to you, we know that okay, this person has very low insulin production. His insulin secretion is very low. He requires insulin. So that is clearly which we can make out. The lean and thin people are the ones who require insulin because they don't have enough insulin. The ones who are overweight or obese tend to have more insulin in their body. So that is how we can clearly make out just by looking at a person how much of insulin
Any
may be produced.
clinical
Yeah,
test for that to give you the proper
pardon
test?
me.
Any
Pardon me.
any medical test or something for that to give you the
Yeah,
proper
yeah, we have tests. I mean, we have tests also. We have tests for everything. But what I'm saying is that just by looking at the person itself, we can understand what is the status of his insulin secretion and all that. There are tests we can do. What is called as C-peptide test or insulin level. Also, we can assess the insulin, and glucose will tell us the insulin resistance in that person. Means how much the insulin is working in a particular person can be known by looking at the insulin and glucose. Somebody who's on insulin, taking insulin already, then we do a different measure called C-peptide. So we can do these tests to understand how much insulin is being produced in a particular patient. Look at his blood sugar levels. We look at the cholesterol levels. All these things will help us in understanding how much of insulin is being produced. What is the way in which this insulin is working? Whether it is working very efficiently or it is not working efficiently.
What's
We can
the
know that.
standard measure of any particular healthy person, the insulin secretion?
Yeah. So we rather than looking at, because there's a wide variation
Yeah.
between somebody who's lean and thin producing how much their insulin they are producing, overweight person how much they are producing. There's a lot of variation, so we don't go by the insulin level itself,
Mm.
but rather what we would see is the glucose level.
But that is HbA1c,
No, yeah, HbA1c or just the fasting glucose level.
everyday sugar.
The
Achha.
fasting
Okay,
glucose level
fasting
is
everyday
normal.
sugar. Okay.
So what we are trying to say is how much insulin is required to produce this, keep this sugar normal. You may require say X amount of insulin to keep your sugar in the normal range.
100%.
Somebody else may require 4 times that amount.
Yes.
So what does it mean? That means that that person who is having higher insulin, 4x amount of insulin, that person has got more insulin resistance. Means his insulin is not working well. He is producing a lot of insulin, but that insulin is not working well.
Okay.
So can we say that you are abnormal because he is having more insulin level and you are having one-fourth the insulin level that that other person is having. So it is not that you are abnormal, but that person who is producing more insulin is abnormal. So more insulin is also not good. It is
No.
not that
True.
more insulin is good. We have to view it in the context of the blood sugar levels.
Mm.
The blood sugar levels are normal. The one who is able to keep it normal with less insulin is the better person. Suppose somebody is able to keep this normal, both have same glucose level, but one person has got 4 times higher insulin level. That means that that person has got more insulin resistance. His pancreas is working more. He's troubling his pancreas, making them produce more insulin to keep his sugar normal. So he has to make changes to sort of offload the pancreas, or rather, you know,
Huh.
make the insulin more effective. And
Utilize it.
this person who has got this, say, suppose you are speaking of two non-diabetic persons,
Yes.
and this person who has got more insulin is the one who is likely to develop diabetes soon,
Mm.
because his and pancreas is getting
Loaded.
working more. It is likely to fail at some time or the other.
Okay. So
Okay, that is
the
how it is. That's
standard range, doctor,
simple
like
measure.
10, 15, 20, something like that.
Yeah, so there is no. That's why I said that there is no specific level for saying that this level of insulin is normal.
Mm.
Rather, we because the insulin, the purpose of insulin is to keep the glucose normal.
Right.
So if the glucose is normal, it means that everything is good.
I see.
And with that also, we are saying that if somebody is able to keep the everything good with lower insulin, then that person is better.
Healthy. Makes sense.
That person is healthier than the person who is requiring more insulin.
Right.
Okay.
Ajay. Um, Now coming to your other part that you were talking just now, in women especially. Now we talked about the glands and the hormones parts and those things. Now another major important hormonal change that women go through, that is estrogen change, and then the menopause stage and those stages. So my question to you is, how estrogen is related to the health of women is context with the cardiac conditions.
Yeah. So that's a very important question that you've raised. So what I would like to just give again a little background about what estrogen does. What estrogen is a hormone produced from the ovary. The estrogen is produced has many functions, like it regulates the heart, as you said, because we want to finally understand how its effect is on the heart.
Yeah.
So it has an effect on the heart, the blood vessels, and then it has an effect on the bone. It increases the deposition of calcium in the bone. It prevents loss of calcium from the bone. So that is another important function of estrogens. And the other important functions are probably in terms of regulating the function of the uterus and all that. It is important for that. So for menstruation to happen and all that, that is again an important function of the estrogens. So estrogens have all these functions. They have these diverse functions. They in fact affect the brain function also. They affect the skin also. The health of the skin also is important from that angle. And then as I told, the brain function, the heart function, the functions of the skeleton. All these things are affected by
Yes.
estrogen. So estrogens are I mean they are produced from the ovaries. They start the production of estrogen starts around the start around the time of puberty. That is from 8 to 10 years, and then it remains high in a woman till the time of menopause.
Mm.
After menopause, what happens is that this is generally around the age of 47 to 50 years in
Yeah.
our country, and what we see is that there's a sudden drop in the estrogen production
Yeah.
because the brain function is coming down, and because of that, what happens is that there's a sudden drop in the estrogen function. So because of that, there are many changes that can happen in the health of a woman. There can be a lot of vascular changes, as you said. It affects the heart and all that. Then it can cause bone loss, because we said that estrogen is
Yes.
preventing the loss of calcium from the bones. So sudden that there can be decline in the calcium deposition in the bones, and that can lead to a
Arthritis
problem.
and those things are
Yeah, that can lead to a problem after 10 to 15 years of menopause, causing what is called osteoporosis and fractures. Commonest fracture we see with osteoporosis is the hip fracture.
yes,
So
people.
these are the common things that can happen. And then the other thing that happens is that there is, apart from that, there can be other because it is responsible for the function of the uterus and the menstruation. That stops after menopause.
Yes.
So all these effects are there. So now what was seen was that the understanding was, can we prevent heart disease by replacing estrogen?
Mm.
So that was a concept which was believed earlier.
Mm.
But what was seen was that there were studies which looked at specifically at estrogen replacement for heart disease. So it was found that probably you don't get much, you get some benefit, but if you're giving it in everybody may not benefit. If you're giving in older people 10, 15 years after menopause, they may not benefit. They may have more problems than benefits. So, and similarly, the bone problems also are better if somebody is taking estrogen. But again, you have got many other options for preventing bone disease. So, what is seen is that it is best required in people who are immediately after menopause if they have got this disturbance in their vascular functions and hot flushes, which we call. They have sudden sweating and palpitations and feel very hot for some time, and then such things happen. That then it can be used. Estrogens can be used. And they can give benefit from that because no other medication helps in that situation. So it is for that for those symptoms it is very useful. For the heart disease, it is when it is given early in the course, it may be helpful, but later on they may not be as helpful, and it can cause certain cancers. Estrogens can cause certain cancers, so that is the major concern, that it can cause breast cancer in people who are prone to develop breast cancers, and those who are prone to develop endometrial cancers. Also, the estrogen excess of estrogen causes that. So those are concerns that we have. So that is the all the concern about hormone replacement, when it is required, when it should not be done. So in some people who have got a higher risk of these of breast cancers or ovarian cancers, they should not be taking estrogens. And similarly, estrogen, when you're giving from outside, it can cause clotting problem, that is formation of what we call as clots in the blood vessels, thrombus as we call it, and this can go into the brain and cause embolism and can cause strokes and all that. So that sort of problem also can happen with estrogens. So these are all the side effects of estrogens when they're given from outside. The endogenous estrogens are good for the person, but when you give estrogens from outside, you have to be aware of these problems, the risks of cancer, the venous
Other
thromboembolism as well.
complications. Yes.
So these are the things that we have to keep in mind whenever we are giving estrogens from outside.
Thank you. Um, Fortunately, I think in India it is not so much in fashion, but the Western countries are working on it more. Doctor, long stay of diabetes causes more complications, as you are telling me from the beginning. I have also seen the extreme situations like paralysis and coma for that matter. What kind of caution of word that you want to say about this? People who are suffering for long, and I tell you the human tendency. Though the doctor suggests us to take the medicines regularly, insulin regularly, after 10-15 years we become little lazy or ignorant for that matter. And then that's where our health is at stake. So can you please give little bit more wisdom about
Yeah. So this is an extension of what we were earlier discussing. That what are the problems with
it?
diabetes? Why are we worried about diabetes? Is that one is that the high sugar itself can cause certain problems, can cause discomfort to the person. All that is there. But in the long run, what we are worried about is the because diabetes can cause kidney failure.
Yes.
So it is now the most important cause of kidney failure. If you go to any dialysis unit, you will find that most of their patients are diabetic patients. Most of the patients who develop kidney failure is because of
Yes.
diabetes.
Yes.
Similarly, diabetes is an important cause of heart failure, heart problems, heart failure or heart attacks. These are very common in people with diabetes. They are both different things. Heart failure and heart attack both are different. But both are very common in with people with diabetes. Then you have got strokes, that is people with paralysis, and so all these things are all common in people with diabetes. And even retinopathy. Retinopathy
Mm.
means that there is a effect of the retina on the retina. The
Losing the
changes
vision.
in the retina caused because of diabetes, and that can, when they become very severe, they can cause bleeding and suddenly the vision can go.
Vision loss
So
also.
blindness can happen. So today, when we are saying earlier days, we used to say that blindness is because of cataract, because of certain infections.
Mm.
Today it is diabetes, which
Diabetes,
is the
yes.
commonest cause of blindness also.
Yes.
So diabetes is very important cause for all these
Silent killer.
problems. That is kidney disease, heart disease, strokes, and even blindness because of and also because of causes neuropathy. It causes neuropathy means the nerve function is affected.
Uh,
So these nerves have a very important protective function. That is, they protect against any sort of injury to our feet and all that. So when that nerves are affected, then there can be small injuries happening, and that can lead to ulcers, foot ulcers, and they can become very severe if they don't heal properly. Then they will require amputation of
Masters.
the feet and all that. So that is again very common in people with diabetes.
Yes.
So diabetes, the major Reason why we are worried about diabetes is that all these long-term complications can develop. So, prevention is the important point. All these has been very clearly shown in very large numbers of people when we have followed up people and seen how much treatment benefits people. It is seen that all these complications are preventable. That is, if somebody keeps their blood sugar under control, they can prevent all these complications as compared to somebody who's not keeping it under control. So prevention is very important right from the beginning. We should keep that in mind that we are able to prevent these complications. We will be preventing these complications and by keeping our blood sugar under control. So
Correct.
that is very important. Now, that is as regards preventing that. But suppose somebody has developed a problem, developed kidney failure, is requiring dialysis. That patient will require insulin for managing his diabetes.
Absolutely.
Somebody who's developed infection in the foot will require insulin. As we said, insulin is required in some situations. We just discussed about insulin,
Absolutely.
where it is required when the body is not able to produce enough insulin. That in all these things, or sometimes there may be harm because of the tablets. As we said,
Ah,
kidney failure is there.
some, yes.
Metformin should not be used. We said similarly, other tablets also they don't get excreted out of the body.
Mm.
They can accumulate in the body. They can cause excessive effect of those medicines.
Liver
They
and
cause
kidney.
hypoglycemia.
Yes.
That's why they cannot use those tablets in the people who have got kidney failure.
Mm.
So now, and then similar problems happen with eye disease and the heart disease. They become sick and they have to they are admitted in the hospital. So they require insulin during that time.
Mm.
So now tell me whether insulin is causing the problem or insulin is would have protected them. So most people what they feel is that they associate insulin with a sick person.
Right. Mm.
They associate insulin with a sick person. Associate insulin with somebody who's having kidney failure.
Right.
But that person is taking because if he had taken insulin earlier,
Protection.
he would have prevented all these problems.
Mm. Mm.
So that is what people don't understand. That is
Mm.
what I want to highlight from your channel. I mean,
Yes,
through
sir.
your
Yes.
this thing, through
Yes.
your program, I would like to tell people that all
Educate.
these people require insulin. They cannot do without insulin. They cannot take anything else, so they are taking insulin. They have to take insulin, and they have probably come into that situation because they have not taken proper care of their diabetes earlier. If they had taken insulin earlier, they would not have come to that. And insulin is not responsible for that. Insulin is a savior for that, for them, even in during that time.
Yes.
Even in such a situation where tablets will not work, insulin is the savior to keep your sugar under control, to keep you protected from further damage and further problems.
Yes.
There again, see, all these people also again have to keep their blood sugar under control to prevent further problems.
Yes.
And what is a savior for them? The insulin is a savior for them. So how can you blame that savior that that person that insulin has caused this? This is what people get confused. They feel that if I take insulin, I will develop kidney failure. If I take insulin, I'm equivalent to that person who has developed kidney failure or that person who has got heart problem. So it is not that. It is that insulin is protecting you from all these problems. If you do not take that, you will have to. Insulin is the only option available, and when you develop these severe problems. So this is a common misconception. I was emphasizing on this
Yes.
because this is a common misconception.
Yes.
Why people don't take insulin when they have very high requirement, very significant requirement for insulin, they don't take it because they remember somebody in their family or somebody they know who had kidney failure or who had heart problem or who had a very severe problems and he was taking insulin. So they feel that because they take insulin, they'll develop that problem.
Develop that. Mm.
So that is something which people have to understand that it is not because of insulin that these problems develop, but insulin is
Because of
helping you.
not
Even
taking it, they have
not
developed.
taking insulin, you have developed that, and insulin is still working in those situations where all other medications have given up. I mean, you have given you cannot depend on all the other medications. You still have to depend on insulin.
Final question, doctor. I don't want to meet a diabetologist ever.
Yeah.
So, what should I do to keep my blood glucose in check and also to moderate my insulin level so well that as much as possible, I don't want to take insulin or medicine for that matter, or even meet the doctor for that.
Yeah. So as I told you that you should try to keep yourself healthy. Try to eat health. Eat right. Eat right means eat more of vegetables.
Mm.
Cut down on your carbohydrate intake,
Carbohydrates.
chapatis and rice, and eat more of vegetables. Eat
How
enough
about
protein
sweets?
and avoid sweets. Too much of sweets. because it may not cause immediate effect, but over a period of time that has impact on your weight, and that can lead to the development of diabetes. So most people, as we said, as I was just mentioning, that there are 100 million people with diabetes. They are more than that. They are almost 200 million people, or double that number of people who have pre-diabetes or some form of disturbance in their glucose metabolism. So all these people are going to develop diabetes. So it is important for all these people, or many of us. I mean, in fact, all of us are at risk of developing diabetes. So we should be eating right, doing regular exercise, spend at least half an hour to 45 minutes every day with some good exercise. That is, either it is some aerobic exercise, or walking, running, swimming, playing some games. All these things are very good. Then also 10 to 15 minutes of muscle building exercises also, twice in a week at least we should do that.
I see.
So that will help in keeping or preserving our muscle, because with age what we do is we tend to lose muscle
Ah,
mass.
yes, yes,
We have more of fat and we have less of muscle
right.
mass,
Yeah.
and that again is an important risk factor for developing various problems. So that is one thing which you should do: diet, proper diet, and adequate
Right.
physical activity, exercise,
Right.
and also having a good sleep.
Mm.
Now, what is seen is that sleep is also very important, and those people who have lesser sleep
Mm.
tend to end up with getting overweight or obese, and they develop diabetes. They have more of heart problems and all that. So have a good sleep, at least 6 hours of sleep every night, 6 to 7 hours of sleep every night. And particularly, this is a problem for people who are working in the night shifts and all that.
Yes.
So they should see that they take adequate sleep during the day, uninterrupted sleep, and where they try to compensate for that loss of sleep. Third thing is that fourth thing is that avoid stress.
Mm.
Lot of stress, unnecessary stress should be avoided. The way you adapt to the stress, I mean, everybody has a lot of stressful factors coming in, but the way you respond to that is important. And the if you have a positive response to that, then you can prevent the damage that happens because of stress. So that is another factor.
Do
I
you
think
recommend fasting also, doctor?
fasting is good for, I mean, those who have to, I mean, are taking excess calories at certain times. You can, you know, use intermittent fasting,
Mm.
keep a so that again a good eating habit, good eating habits. If you have, if you're eating at night, particularly these people who are working in the night, if they're
Mm.
eating
Mm.
at night,
Mm.
that is more harmful than the staying awake. But is the
Mm.
eating at night is more
Mm.
harmful. So
Mm.
that eating in the right time is very
Timing, huh?
important. So that is now given different names like intermittent fasting,
Ah,
or time dependent
yes,
eating,
yes,
or
yes.
whatever we call it. We call so many names for that. But
Correct.
I think it's basically that you have healthy eating habits,
Yes.
and good sleep, and avoid stress. Uh, all these things are going to prevent you from, I mean, if you are able to do these things, you'll not need to go to a diabetologist or endocrinologist, and you can
In
actually take
futures.
care of your health. So you should start taking care of your own health and avoid, I mean, then you don't need to take the help of any of these people.
So we pray that as much as possible people follow this advice and keep their sugar level in check so they don't indulge with medicines and then so-called myths. Thank you very much for your time and it was great enriching discussion with you. Thank you so much. Namaste.
Thank you. Thank you, Namaste. I hope people benefit from this discussion.
Definitely not.
Thank you.
Definitely.